Okay, then we go to valsalum. Valsalum, it is in the angulation of the vagina or of the pubic arch. Okay, so when you put it and hold, this is an instrument used to hold the anterior or the posterior lip of the cervix, depending on the type of procedure. Mostly in the OPDs we use the anterior lip in case of bleeding and ED. Now this is not required, but if required you can use it to anterior. But this is a traumatic instrument, so it can cause trauma to the cervix, which can cause bleeding. Prerequisites of pap smear is a must. You should know about prerequisites, when you can do, when you cannot do it. Okay, so this angulation is the angulation of the pubic arch, so that it comes along the pubic, doesn't obstruct your view also. You cannot hold it like this. If you hold it like this and pull the cervix, this instrument will be obstructing the view of the anterior and the posterior lip. So it has to be in the arch. Hold the instrument in the way you are going to use the instrument. Okay, hope you all know this. You don't use it like this, you use it like this. This is for the support of the instrument. These two are through the thing. Even the scissors, when we use, these two are the thing. One we have to support the instrument. Okay. This is a sponge holder. Okay. It has striations inside and open thing on either side. This is an atraumatic instrument. This again is used for, you can use it for cleaning and painting the parts. Okay, you can also use it to hold the cervix. In case of post-delivery or post-natal part, this is the instrument which we use to hold the cervix. We do not use valsalum at that time, because it is traumatic contact. Because at that time the cervix are too fragile, they're soft and they're very supple. So they can cause injury. That can cause injury and cause bleeding. So that is the time when we use sponge holders for holding the cervix. Okay, that time we need not have grip. We just need to hold it. This much is enough for the grip. Okay. So sponge holder, again you have to tell about the uses and the different uses in different procedures. Okay, mostly for draping and for painting the surgical parts. Okay, then for holding the cervix, anterior lip, along for especially postnatal delivery, postnatal period. This is an Alice. Okay, you get short, small Alices and long Alices. Again, Alice, if you take, they will ask you where in all instruments these Alices are used. Okay, this is again a traumatic instrument. It has serrations at the edge, tooth-like serrations, where you get a good grip of the thing. What are the layers of the abdomen you hold with Alice? Rectus sheath. We don't hold the skin. No. The skins are not used for holding. I mean, Alices are not used for holding same problem, because it is serrated. You can cut through the skin. That much sharp they will be. Okay, so don't use it for the skin. It's usually mainly used for the rectus sheath. Okay. And tough tissues to hold like peritoneum, to hold the peritoneum. Those things you use the Alice. This is okay. Laparoscopy will come at the end. This is a curved scissors. Okay, the curved scissors. It is curved in the angle of the tissue cutting, so that we don't. If it is straight, you might go and prick the underlying structures. So it is always in the curved thing. So these are used for cutting tissues. Okay. There will be one more straight, which are used for cutting suture material. Suture material you lift up and you cut. But for tissues, when you are cutting, the underlying structure should not be poked with the edge. So that is why they are always curved. Okay. These are tissue cutting curved scissors. Okay. This is anybody knows what is this?
Sound.
It is a bladder metal catheter. Bladder metal catheters. Okay. For used in vaginal surgeries, where you have to empty the bladder before proceeding for the procedure, and in between also we empty the bladder to see if the urine is clear and to look for any bladder injuries and all that. Okay. And they are also used for not permanent catheterization, just transient. You want to empty the bladder during labor also you can use, but we prevent this during labor, again because it will cause injury. These are metal catheters. They can cause injury to the urethra or the surrounding structures, because they are very vascular at that time. Okay. What is this?
Uterine sound.
So this is the uterine sound. Uterine sound has an angulation of the cervico and the uterus junction. They have an angle. No? They are either antiverted. If you keep it like this, they are antiverted. So when you have to put a sound, you have to first examine using bimanual examination. You have to determine whether the uterus is anterior or whether the uterus is retroverted. Okay, so if it is antiverted, you will put the sound in this direction. So the uterus, this will go and touch the fundus. Okay, that and the secretions will be staining this tube, and at the cervix level, when you see the markings will be seen. So this is in inches. Okay, few of the sounds will be marked in centimeters also. So you have to see this is in inches. This sound which is kept is in inches. So the UCL, that is the uterocervical length, is measured using the sound, and also used for initial dilatation also, because this is the thinnest one. It can go through the cervix. Okay, where is it used? OPD procedure.
DNC.
Biopsy
And DNC.
Before inserting an IUCD. Before inserting an IUCD, before inserting a Marina, you will have to measure the UCL. So according to the UCL only, we have to keep this ring adjusted. Okay, so this ring is adjusted according to the UCL. So that measurement is seen and adjusted here. Okay, so the